Okay, so we're here today to talk about the InBody direct segmental bioimpedance analysis. It's a machine that we got earlier on this year, in 2021, and it breaks down lots of different indicators that we use for pretty much all weight loss treatments and fat reduction treatments with individuals to give us a detailed look at what needs improving, if anything does, and where the strengths and where the weaknesses are, and then we can kind of go from there. So if we just have a look through what we've got. So this is a 62-year-old female, 160 centimeters tall, kind of average person, you might say, for age and height in England. We've got total body water, which breaks down the intra and extracellular water, protein concentration, density and quality of muscle tissue, amino acid profile. So if someone has well-developed muscle tissue, then that amino acids and proteins, the contractile proteins, will be high. For this individual, she's a bit on the low side, which would then mean that her mineral profile is also going to be a bit low. In order to have strong bones, you need to have muscle tissue that protect them. So we know so far these two need some improvement. Below that body fat mass, as with most people, it tends to be a little bit over, but obviously that is something that we work to fix. Then we have weight, which is the sum of all of the above figures. We then have muscle fat analysis. We've got weight, muscle tissue, and body fat mass. We can see here body fat mass needs to come down. Skeletal muscle mass could do with going up a little bit. So all three figures are in the middle. With obesity, we always ignore BMI because, to be honest, it's just not something that should be used anymore, really. Below that body fat percentage, this individual is sitting at 37.5, which is a bit high, and we'd like to see down to 28 or below. But again, that's something that we will address later on. Now we've got segmental lean tissue, so muscle tissue broken down to body parts, so we can see exactly where needs the work. So fine and relatively balanced and symmetrical on the torso and each arm. We've then got slightly under on the legs. So ideally some resistance exercise on the legs and a little bit overall would be beneficial. And we've then got segmental fat analysis. So we've got left and right upper body, torso and each leg. It's always going to be relatively balanced left to right side. We can see that the lion's share of body fat is sat here on the stomach, 12.2 kilograms of body fat on the stomach. This is the area in question that the client would like to work on and use our fat reduction treatment such as cryolipolysis, the 360 fat freezing procedure, to help eliminate some of this body fat around here. So it's a good way for us to gauge the before and after of the success of the treatment along with general weight loss. At the top, we've got a score, 66 out of 100. It's just a way to gauge your performance. I'd refer to that as a D if this was her taking her exams. So hopefully we can improve that. Then we've got a breakdown of what would be good to focus on and what would be good to change. So ideally, she'd lose 10.7 kilograms of body fat and gain 3.4 kilograms of muscle tissue. It takes some time for females to gain quality muscle tissue. So this is more something that's going to take around 6 to 12 months, but the body fat can come down a lot faster. And if we skip down to here, visceral fat level, this is the internal fat that surrounds heart and organs. This is the important fat. If this is high, risk of type 2 diabetes, fatty liver disease, stroke risk, various health indicators increase with this being high. We are increasingly seeing people in their early 20s and late teens that have their visceral fat up close to the high, if not at the high level, which is alarming to say the least. Coming down, basal metabolic rate. This is how many calories your body burns at rest over a 24-hour period. Your brain will burn around 400 and the rest will be done by your body. So this is your internal fire, your engine, so to speak. There's a range here that is specific to this individual. Now, you can see that she's at the bottom and below the bottom end of the actual range. So your metabolic rate, your metabolism is something that can be dictated to a point. It's dictated by 4 main key factors: frequency of eating, frequency of movement, age, and genetics. You can't cheat genetics and age, but you can play with the other 2 to improve this. The more muscle tissue you have on your body, the higher your metabolic rate. The frequency and intensity of exercise will go a long way to improving that. This figure here, 1380, recommended calorie intake, that's her total daily energy expenditure. If she eats 1,380 calories, then she will maintain her weight. This means that her margin between that is relatively small, which means that in order to lose weight, she has to go between her BMR and her total daily energy expenditure, so around 12.75 to 13.